Good morning, Dr. Vikram.
Good morning.
Dr. Vikram, today we are here to discuss you can say, discomfortable disease, anal fistula.
Very uncomfortable.
Yeah, so many people these days are complaining of this anal fistula.
Yeah.
So please tell us about this, what it is exactly.
Actually, anal fistula, you see, this is anal canal. For example, just imagine this is a canal.
Okay.
And from this outer end, the stool usually pass out from the outer end.
Yeah.
But when it starts to come out when another opening forms in the skin, the stool starts to come from that. It is not stool coming out actually.
Okay.
It is an opening from the anal canal, from inside the anal canal to the outside surface. And that is filled with pus, with abscess, and it's very painful and very difficult situation for the patient.
Okay.
Here I want to show you actually what happens.
Okay, please.
See, this is suppose this is outer opening of an anal canal, right? And this is the outer skin, right? This is outer skin, and the stool should come out from here.
Yes.
But what happens? There is another tract from here, and from inside, from the anal canal to the outer skin. So this sometimes it heals, it closes up. Sometimes it opens up, and there is anal abscess. This is called pus.
Okay.
Under this opening there is pus filled, and sometimes this opening opens up and then
Pus comes
closes.
out.
Pus. So it may become bigger. Sometimes there are multiple openings also, like this. So sometimes there are openings.
That's why it's very discomfortable.
So it is very difficult to sit, and very problematic for the patient.
So, what are the causes of this disease, Dr. Vikram?
Yeah, causes basically there is an infection. In Ayurveda, it is mentioned that if you hold your urges, natural urges, for longer period of time, that is going to cause a lot of problems.
Okay.
So, number one is holding the urges. Number two is infection.
Okay.
If you hold the urges for long and you don't go to pass out the stool, and there are chances of getting infection. There are other diseases like ulcerative colitis, there is Crohn's disease, chronic constipation, and some injury also in the anorectal area. And these are the common causes. So these should be avoided, and improper hygiene also, because if there is abscess formation in the anal canal, that is also due to some unhygienic conditions.
Okay, and diet and lifestyle also.
Of course, diet. Yeah, as I told you, because this constipation is caused by mainly diet.
Okay.
So not taking enough fiber food in the diet, not consuming enough fruits, not consuming enough vegetables, and low immunity. All these things, they lead to infection in the anal canal and lead to stasis of the abdominal canal.
So one should follow a healthy lifestyle and very hygienic lifestyle.
Yeah.
So this is the part one can handle. But if someone suffers, then what exactly the treatment is available in Ayurveda or other pathies?
Yeah. In practically speaking, there are in modern medicine they use fistulectomy, the cutting of the fistula, just relaxing the muscle, and so that it heals up automatically. But we have seen in many times it comes up again and again. Once you get
many patients they complain.
They come to our clinic and they say that we went through surgery and it happened again. So in Ayurveda there is Shar Sutra therapy also. It is using the thread, alkaline thread, and tying it up, and it's again working on the principle of cutting and healing. So it is the Shar Sutra is also very successful. But if a patient doesn't want to go for surgery, there are some Ayurvedic herbs.
So one can use only herbs to heal.
Yeah, there are many Ayurvedic herbs and supplements and tablets, and classical tablets.
So Dr. Vikram, please explain in a little detail so that people can understand how medicines can work.
So the three ways to heal the fistula. One of them is cleansing the rectum, cleansing the colon.
Okay.
So I use this Vara Churna. Basically, it is not only colon cleansing.
Okay.
Vara means best. The literal meaning of Vara is the best.
Okay.
So Vara is used for the trifla. So
Okay.
3 fruits are there. The 3 fruit powder is best colon cleansing. It clears the passage.
Okay.
And then I use this Trifla Gukul.
Okay.
Yeah, these are the tablets. This Trifla Gukul. Gukul has healing properties.
Okay.
Gukul is a very good natural antibiotic.
Okay.
So Gukul, I use the Trifla Gukul particularly. It cleanses the system. It also provides immunity. Moreover, Vara also provides immunity to the system.
Okay.
Alkalizes the system, and it helps to heal the wounds.
Okay.
Even I have used this Kishore Gukul and Trifla Gukul combinations
Okay.
in healing of non-healing wounds, of diabetic wounds,
Okay.
and so many wounds.
So it's a best antibiotic.
Best natural antibiotic without having any side effects.
Okay.
And another thing I use, it's a miracle herb, it's called curcumin.
Okay.
Curcumin nowadays worldwide famous for its use in cancer, for its use in as antibiotic, for its
Okay.
use as anti-inflammatory drug, for its use as a painkiller, for
Okay.
it's all these properties free from any side effects. So curcumin is basically active ingredient, active component from the turmeric.
Okay.
Yeah, very commonly found turmeric in India.
Yeah.
So turmeric is standardized and made into extract, and it's called curcumin. And we use curcumin 95% so
Okay.
that we get the maximum results.
Okay. So it helps healing
Using these
wound.
three supplements together,
Okay.
and this clears away the pus and the recurrent fistula. So for local application, I use this Nirgundi oil.
Okay. For local
Yeah,
application.
Nirgundi is a herb. Basically, Vitex Nirgundo is a plant. The oil is made from that plant.
Okay.
So it is a local anti-infective. So
Okay.
it prevents the infection, reinfection and recurrent infection.
Okay.
So applying after going through the toilet,
Okay.
2 times a day is recommended. And
Okay.
slowly I have seen patients within 15 days they give very good report. If I
Okay.
give all these 3 supplements together, all these Ayurvedic medicines together,
Okay.
within 15-20 days,
Yeah, even if they're having 2 or 3 openings
Yeah,
like
yeah.
this, even then it's
they say, I don't say they immediately they are cured.
okay. It
in
takes
15
time.
days. It takes time,
Okay.
3 months, 4 months also.
Okay.
But in 15 days they report that they are very good. They are getting good results.
Okay. Symptomatically they feel good.
Yeah.
So
The opening is actually, the actual opening it gets closed. The outer
Okay.
opening.
Okay.
And slowly from inside, so it should be continued for 3-4 months.
Okay.
So that the pus,
Even if someone feels
the pus inside dries up.
okay. So this combination should be used 3-4 months.
And one more message I want to give to fistula patients, that they should maintain a proper hygiene of the area.
Okay.
It is very important to take sit baths. Sit bath is just sitting in the alkaline salty water,
Okay.
and in Dettol you can add some anti-infective.
Okay.
Rather than you can use natural antibiotic like neem also.
Okay.
Just take some neem leaves and
Okay.
make decoction, and then put
In a tub.
just put in the tub, and then you can sit in that water.
Okay. For
Neem
10
is very good.
for 10-15 minutes it's okay.
Yeah, for 10 minutes, 5 minutes also. 10
Okay.
minutes, okay. Warm water is recommended.
Okay.
So basically to maintain the hygiene, I
Right.
prefer neem over antibiotics over Dettol or betadine.
Okay.
So neem, I have seen better results with neem.
Okay. So Dr. Vikram, thank you very much for this very great information, and many people will be benefited. Thank you.
Thank you very much.